Today, we're diving into a decision that's, well, pretty permanent. We're talking about choosing the right material for a dental implant, something that's literally going to be a part of your body for decades.
You know, this is probably the #1 question on pretty much every patient's mind, right? Is it going to look real? You want that perfect, natural-looking smile. But here's the thing. What a lot of people don't realize is that this actually isn't the first big choice you have to make.
Exactly. Before you even start thinking about the color of the crown, we need to talk about something way more fundamental. We're talking about the very core of your new tooth, the implant that's actually placed into your jawbone.
So to really get why this choice matters so much, let's just quickly break down what a dental implant actually is.
The easiest way to think about it is like an artificial tooth root. It's this small post that gets placed right into your jawbone, and here's the amazing part. It actually fuses with your bone. It becomes a permanent part of you. And because of that, the material of this little post, it affects everything. Its strength, how your body reacts to it, and yep, even how it looks down the road.
All right, let's kick things off with the OG, the material that basically built modern implant dentistry as we know it, titanium.
The story behind this is actually pretty cool. It all started by accident, way back in 1952. A surgeon realized that little titanium chambers had completely fused to the bone in one of his research subjects. So this led to the very first human implant in 1965. And get this, that same implant was still working perfectly when the patient passed away 41 years later. I mean, talk about a track record.
So what makes it the gold standard? Well, for starters, it's crazy strong, it doesn't corrode in your mouth, and it has more than 60 years of solid research backing it up. We're talking success rates of over 95% for that bone fusion, and even after 20 years, about 90% are still going strong. You just can't beat that kind of predictability.
But of course, it's not perfect in every single case. The one potential issue with titanium is its color. It's a dark gray metal, so if you happen to have thin gums, there's a chance you might see a little grayish shadow right at the gum line, what some people call a gray halo.
And that concern over aesthetics? Well, that's exactly what pushed science to come up with a modern, metal-free alternative, zirconium.
Now, technically, these implants are made from zirconia, which is a super high-tech ceramic. It's so strong it's even got the nickname ceramic steel. But the real reason people love it? It's naturally the color of a tooth.
And this is really where zirconium shines. That white color is a game changer, especially for front teeth that everyone sees. It's also hypoallergenic, so it's the perfect answer for that small group of people who have metal sensitivities. Oh, and some research suggests it might not attract as much plaque. The survival rates we've seen so far? They're fantastic, right up there with titanium. So what's the catch?
Well, it's really about time. We have about 2 decades of research on zirconium, which is great, and the results look really promising. But that just doesn't compare to the 60+ years of data we have for titanium. That super long-term, multi-decade proof, it's just not there yet.
Okay, let's do a direct comparison. How do these two really stack up when you put them head-to-head?
When you lay it out like this, it gets pretty clear. For looks, zirconium wins, hands down, no contest. But when it comes to proven, long-term strength and just sheer history of research, titanium's got the clear advantage. If you have metal allergies, zirconium is your answer. But for your wallet, titanium is almost always the more affordable choice.
So you see, it's not really a question of which one is better overall. The real question is, which one is better for you?
And you can figure that out by thinking through a few key things. First, where's this implant going? Is it a front tooth that everyone sees or a back molar that needs to be super strong? Second, what are your gums like? Are they thin? Third, do you know if you have any metal allergies? And finally, what's your budget? Answering these questions with your dentist is how you're going to make a choice you feel great about.
All right, let's wrap this up with the key points you need to remember as you move forward.
So here's the bottom line. Both of these are fantastic, safe, and effective options. Titanium is the proven workhorse. It's predictable and a great value. Zirconium is the aesthetic superstar, perfect for that flawless, metal-free look. The absolute best choice really truly depends on you, your body, your goals, and your priorities.
Look, I get it. This can feel like a really big decision. And that's why the source material for today's explainer points out that there are independent resources out there. For example, a service like Turkiye Dental Guide can offer impartial second opinions and transparent planning, which can be super helpful for patients trying to sort through these complex choices with confidence.
The whole point of this is so you can walk into that dentist's office not just as a patient, but as an informed partner in your own health. You're now equipped with the right knowledge. And honestly, the biggest choice you make isn't just the material, it's choosing to be this informed. So now you know what to think about. What's the first big question you're going to ask?